Hi, everyone. Welcome to the HelloFam Podcast. I'm your host, Shalini, and I'm excited to have you all here with us today. We hope you've all been continuing to enjoy our podcast, as well as the snippets we've been uploading to our social media platforms. To stay up to date on our latest features, please make sure to follow us on LinkedIn and Facebook, and we're also available on social media, so follow us at hellofam.app on TikTok, Instagram, and YouTube. Now, back to the podcast where we talk to longevity doctors, key opinion leaders, and others onto their views into longevity. Our goal is to provide you with greater insight into the world of living long and well as learn some practical tips to incorporate into your daily lives. So join me in welcoming today's guest speaker, Dr. Nicki Braxley, our very own KOL.
Hi, thank you so much for having me. It's such a pleasure to be here.
And thank you so much for taking the time out of your schedule to come meet with us today. So starting off, can you give us a little background about yourself, how you got to medicine, HelloFam, as well as any hobbies and interests you may have?
Sure. So I come to you from Atlanta, Georgia. I'm originally from Chicago, and I've moved all over. In fact, I've been practicing medicine for about 15 years, and I have practiced medicine in 11 emergency departments, 6 states, in 3 countries. I mean, I've literally been all over the place. And I have a background in emergency medicine, but I fell into longevity medicine after my own personal journey, which so many of us have these similar stories. A couple of years ago, I was realizing after my second child and right on the cusp of perimenopause that my body was changing rapidly and I didn't know what was going on. And I started down this rabbit hole of trying to figure out, was I really optimizing things for myself and my health? Both of my parents passed away at very young ages. And working in the emergency department, I see some really sad cases. I see people hit by cars. I see patients diagnosed with cancer. I see patients who really aren't that old, but don't have a high quality of life. And I started thinking to myself, again, am I doing everything that I possibly can to optimize my health span and lifespan? And that's what led me down this longevity journey. So it's been a bit of a rabbit hole for me, but I love the topic. I'm incredibly passionate about it, and I'm super excited to talk with you about it today.
I'm glad to hear it. Thank you so much. You've definitely had a very comprehensive experience and well-traveled, it seems. So thank you for sharing, and I hope our listeners are excited to learn more about what you learned on your own longevity journey. So starting off, we have to ask, what is your definition of longevity and what does it mean to you?
I think this is a fascinating question because if you were to just Google longevity medicine, I mean, the wide-ranging variations that you'll get are absolutely astounding. For me personally, longevity is not living to 130 or even 102 necessarily. But it is having a lifespan that maybe goes beyond traditional definitions. I mean, the average age where someone passes away in the United States can be anywhere from your late 70s to your mid 80s. But more importantly, way more importantly than how old you live is what your health is like. And so to me, longevity is not simply the absence of disease, which is what I think a lot of our physicians out there that are in the traditional primary care setting are thinking about. It is not the absence of disease, but it is thriving in life. So it's not only how long you live, but also how healthy you feel when you are aging, and how do we optimize for that. So longevity medicine to me is way more than a green smoothie or adding a certain powder to your foods, but it's a lot of hard work and effort and really concentrated effort. As early as possible so that you can optimize your health span as well as your lifespan.
Yeah, exactly. And that's also tying to HelloFam. We have 10 core different areas of longevity because longevity is just not about being physically well, but it's like cognitively, emotionally, socially. So thank you so much. And going along with tackling longevity, how can people reframe the thinking of what do I do to what are my goals for fighting longevity and actually trying to achieve it? And what are some examples?
Sure. And so I think one of the things that people need to realize, and I see this misconception a lot, people will say, it's too late for me. I'm too old. Or conversely, I'm too young and I don't need to be thinking about longevity yet because I'm only in my 30s or I don't have any health problems. But I think it's important that people reframe the longevity discussion and draw it to a parallel, just like retirement savings. So you need to retire for the end of your life because someday you're not going to be able to work anymore. And it's true, you can start saving for retirement whenever you want. And you can wait until you're 70 to start saving for retirement. But if you start saving for retirement earlier in your 30s and your 40s, that money compounds over time. And by the time you retire, you have built up a tremendous amount of wealth and you have a lot more to go off of for the rest of your retirement. Well, longevity and health is exactly the same way. So the earlier you start thinking about longevity and you start pinpointing very specific things that you need to work on, the better off you're going to be when the inevitable decline comes. Because the reality is we all have to age. I don't think that within our lifetime there is going to be an infusion or a drug or a peptide that you're going to be able to put into your body that's going to delay the onset of aging. And so what we need to do is build up all of our reserves so that when that decline comes, we are starting from a much higher spot and the decline feels less precipitous than it's going to be if we choose to do nothing. So very specifically, and as you mentioned, HelloFam has these areas kind of laid out. When people come to me and they start asking what they need to do for their longevity journey, I think about cardiovascular strength. We talk about nutrition and how to optimize that. You think about cancer and how to screen for cancers and making sure you're up to date with that. And a lot of us are worried about our neurodegenerative diseases like dementia. And so what do we need to do to optimize for that? And honestly, if you have to think about one area where everything circles back to, it really comes back to metabolic health and really optimizing your metabolic health and making sure that that is in order if you want to get the biggest bang up for your buck in just kind of one area that's going to hit so many future areas of longevity.
Mm-hmm. Exactly. I think it's also just what you were mainly saying as a more TLDR generalization. It's prevention rather than reaction, because you'd rather take steps early or later, whenever, just to start preventing these obvious signs of aging that will inevitably occur. Because, yes, as you said, in our lifetime, we're not going to have a cure or even be able to freeze aging. It's more about what can you do to prevent these more chronic diseases arising as you age. So going along with this, instead of simply just saying like moving more, how can people based on their demographics understand and change their exercise to maximize their physical well-being?
So I think you can break exercise down into 3 categories. One of them is going to be your cardiovascular fitness. Another will be your strength. And then the third area will be stability. And you really need to focus on all 3 of these areas in order to optimize your exercise in general. Personally, if you have the bandwidth, I think the very best way to start is by an assessment. And there are numerous ways to do assessments out there. The gold standard is a DEXA scan. There are a lot of 3D fit machines and different things that will do body scans for you. But you want to get a sense of how much muscle mass you already have, what percentage of body fat you have, what percentage of visceral fat you have around your organs. And then with stability, there are many different programs that can look at how flexible you are and how stable you are, and start with your assessment and kind of see which area is the weakest and which is the strongest and where do you want to focus your efforts. If you have 8 hours a day to exercise, great, I can give you a comprehensive program that takes 8 hours a day, but the reality is we don't have that. So part of this programming too is figuring out how much time you do have. If you're starting from zero, i.e. you sit on the couch and you really don't exercise, there has been a tremendous amount of research that shows if you can just do 30 minutes 3 times a week, you can improve your overall cardiovascular fitness by almost 20% within just a few short weeks. So you can get really tremendous gains with very little effort. But again, you can move forward to see, do I need to focus on cardiovascular? Do I need to improve my strength? Or should I be starting with stability? If you are optimizing your cardiovascular and your strength, maybe you need to be adding in stability work about once a week. But everything's going to be different for each person. I don't think that there's a one-size-fits-all, that if you do this one exercise training program, it's going to be great for every individual out there, because it really just depends on where you're starting from and what your overall goals are.
Yeah. And something complementary to that, we hear about physical exercise. Now let's switch it to dieting. How can the timing of food intake affect and reduce obesity? Because these two things go hand in hand. You can exercise, but if you're engaging in not the best nutritional foods, it's gonna not work. But more than just dieting, how could timing of food affect that?
One of my favorite statements, which I'm sure others have heard, but it just really struck a chord with me, is the statement where you say abs are made in the kitchen. And I was like, what does that mean? And what that means is if you want to lose weight, it's not necessarily about the cardiovascular training that you're doing. It's about the food that you're putting into your body. And so, again, just like exercise, there's not one program that fits every individual. For nutrition, there are different nutritional needs depending on who you are and where you're starting from. And then again, what your goals are. Overall, you have a few different ways that you can lose weight if you're looking at nutrition. One of them is you could just do a straight caloric reduction. And if someone was interested in this type of process, I would recommend a food app where you are logging everything that you're eating, counting your calories, and more importantly, your macros, probably your fat, your protein, and your carbohydrates, and just doing an overall caloric reduction. And that has proven to work for some people. But as you mentioned, when you eat is also really important. There's a lot of information out there about intermittent fasting, and that would be a fasting window of either maybe a 16-hour fast where you're eating 8 hours of the day. You can vary the times. And then there's also people that are doing multi-day fasting. The research on them is not perfect. We do have research in animal models that are not necessarily humans. The human clinical trials are pretty good, although not amazing. So the jury is still out on how great intermittent fasting is. However, for weight loss alone, intermittent fasting has been proven to be one way that people can reduce how much food they're taking in and thereby lose weight. It's going to be different for each person. It's going to depend if you're going through menopause or not. So for example, there's been some studies that show that if you are in menopause, you probably shouldn't be intermittent fasting. One of the other challenges of intermittent fasting is making sure that you get enough protein in your diet, especially because you want to be building strength at the same time. So taking these things into account. But basically what happens when you're intermittent fasting is you are not supplying your body with glucose, and therefore your insulin levels drop. And when your insulin levels drop and your body doesn't have any glucose to create energy, your body has to get energy from someplace else. And so what it does is it shifts into this process called ketosis, and that's when you start burning fat. So when we talk about intermittent fasting being fat burning, that's what's happening. You're basically burning the fat off of your body, turning it into ketones, and then your body is using those ketones to produce energy so that you can go about your daily activities. So again, there's different ways you can do intermittent fasting, and what you eat does matter. You can't intermittent fast and eat cheeseburgers and ice cream for the 8-hour feeding window, right? We have to put good food into our body. We still need to watch our macros. But it has been proven really successful for a lot of people that are looking to reduce their weight.
Yeah, that was a great breakdown of the difference between what you eat versus when you eat, as well as the science behind that too, because they say it's fat burning, but again, sometimes if people don't have a good science background or don't know this in depth, especially someone with an MD degree, it was a great explanation. So yeah. And then switching gears to a more recent trend, actually, do you see drugs such as Ozempic being more harmful or beneficial to the U.S. population? Since for the first time in a decade, there's been a dip in obesity rate in America. But again, it's due to this novel drug. What are your thoughts and opinions on it?
I think that the use of these GLP-1 inhibitors has been a tremendous breakthrough for our society. I am not 100% against them. I will say that I really, really hope that people will try other techniques before they go straight to the drug. And there's a few reasons for that. Number one is they're very expensive. So in the short term, insurance might cover them for many people, and that's lovely. But if you're not having insurance covered, it can be quite pricey. Number two is there have been studies that show some people, a lot of people, when they stop taking the drug, they can actually gain the weight back. And how sad is that and terrible? So then you have to ask yourself, are you going to be on this forever? So hopefully if people are choosing to start this medication, they are also incorporating good eating habits and exercise and strength training into their regular programming so that when they do eventually come off of the drug, they have other changes in their lifestyle that they can anchor to so that they're not 100% dependent on this drug for weight loss. And then number 3, frankly, the drug just hasn't been around for all that long. It has been in existence longer than people probably know about. It's been well over a decade that people have used it, and the iterations have gotten safer and safer as the drug has been out there longer. And so far, the short-term health benefits seem to be net positive. I just think there's a time and a place for it. So if you are a person who has struggled with obesity and you are developing signs of metabolic syndrome or insulin resistance or diabetes or fatty liver, and you have tried all of these other techniques to get your metabolics in order as far as exercise and dietary changes and weight loss, and nothing is working for you, then I think this is literally a miracle drug. Because by reducing your weight and getting yourself metabolically healthy, you will definitively add years to your life, and your health span is going to be so much improved. That being said, if you're out there and you're like, oh, I just want to lose 10 pounds before my vacation next month, I don't know that I would recommend the drug for you. I think there are other ways to do it that are a little bit safer. So a time and a place. I'm really excited about the prospect of the medications. I'm so happy that they're available to so many thousands of patients have been successful with them. I just hope that people don't go to them first line like we have traditionally in America with other pills and medications, where we just anticipate that this one medicine is going to make it all better with very little effort on our part, because I do think it's kind of a multidisciplinary approach.
Yeah, exactly. And I think there does need to be a line between what is necessary and what is something that is wanted, as well as accessibility. And exactly what you said, this drug has actually been around for more than a decade. And it was actually, if I'm not mistaken, derived from a drug meant to be treating diabetes. So when Ozempic first came out, it was meant to help mitigate or control glucose insulin levels for those who are diabetic. But when Ozempic's positive side effect of weight loss came out, it became more of a net trend in a way. It started to reduce availability to those who actually need it. So yeah, I completely agree with what you said. And I like that you took a multifaceted approach to explaining the positives and negatives of it. And going, again, along with the line of metabolism, and as your background as a physician, so to treat these metabolic disorders or things like obesity, what labs seem to be missing from the annual PCP visits that you have noticed?
So they're maybe not necessarily linked to metabolic syndrome themselves, but there are a few labs that I recommend patients talk to their doctors about. Number 1 is a lab called ApoB, and then another one called LP(a). So ApoB and LP(a) are 2 markers of cardiovascular disorders that people should know about. ApoE is a better assay to directly measure how much cholesterol is floating around in your system. And ApoB should be used in conjunction with your cholesterol levels to determine if you need to change your diet or if you need to go on a medication like a statin to reduce your risk of heart attack long term. LP(a) is a fascinating test. It's a one-time blood test. So people just go once and they get it and they never have to get it again. And if you have an elevated LP(a), and about 20% of the population does, you are at an incredibly higher risk for a future cardiovascular disease, so a heart attack. So LP(a) on its own should be a warning sign to you that you in particular need to really optimize your cardiovascular health, because you are at higher risk of developing a heart attack at a young age. So those are 2 blood tests. ApoB is something you would get maybe annually or every 6 months, and you would trend it. LP(a) is a one-time test. Another test that I would recommend to patients ask their doctor about is called ApoE. This also is a one-time test. This is almost like a genetic screen. I actually heard that if you use 23andMe or one of those other genetic testing companies, they will give you your ApoE back. Patients that have 2 copies of the ApoE4 gene have been shown to have higher risk of Alzheimer's or dementia as they age. And we don't know why, but women are particularly affected by this at a much greater rate than men. So if you have ApoE4 and you have 1 or 2 copies of the gene, it doesn't mean you are 100% going to go on to develop dementia, but we have seen studies show that you are at higher risk of developing dementia. So again, what it should be for you is a warning sign that you in particular need to truly optimize everything within your power to reduce your chances of getting Alzheimer's and dementia. And surprise, it all goes back to metabolic health and vascular health. There's one more test that I would love for our primary care offices to offer. I think it is really hard to get, but it's an oral glucose tolerance test. This is something that everyone who's ever been pregnant, so our female patients that have had a child, will go through an oral glucose tolerance test. And this is a test for diabetes. Again, a little bit hard for the primary care doctors to order it. And so if your PCP is like, I don't know what to do with that information, the other way that you can look for early onset diabetes or insulin resistance is using a CGM, which stands for a continuous glucose monitor. These were previously only available by prescription, and now they do have a few brands out there where you do not need a prescription and you don't have to have diabetes in order to order one. And they're not too terribly expensive, although if you don't have diabetes, you're likely going to be paying out of pocket for them. But what you're doing is wearing this, and it is monitoring your glucose real time with every aspect of your day. So whether you get good sleep or bad sleep, if you are stressed, if you are exercising, if you are doing intermittent fasting, if you're having a piece of chocolate cake at your friend's birthday party, you get real-time feedback on the carbohydrate intake and how your body is responding to carbohydrates. And it's just a tremendous source of information for you so that you can understand how your body is affected by the foods that you eat and the various times of the day. And so there are some parameters that we monitor on patients who are wearing CGMs. And if these parameters are elevated, it tells us that they have insulin resistance. Insulin resistance can predate diabetes by about 10 years. So when you want to talk about preventative medicine, having an idea that someone is insulin resistant literally gives you a 10-year head start to help them to change their course so that they do not go on to develop diabetes. Just a tremendous amount of information that can be gained from this very simple skin apparatus that you wear for 2 weeks at a time. So again, a lot of information there, I know. ApoB, LP(a), those are cardiovascular tests. Your ApoE or ApoE4 gene, and then looking at a continuous glucose monitor for metabolic syndrome.
That's a shocking statistic to know, or shocking that you can catch it 10 years in advance and actually be able to do an intervention and mitigate the rise of insulin resistance. So again, these are tests I've never even been aware of, and I'll make sure that to our listeners that when we post this, I'll note it down so you're able to also ask your PCP about this. So thank you again for sharing this, I guess, insider information. And as we near the end of this podcast, I guess, what is a piece of advice that you'd give to every patient out there?
The thing that I would like to change out there in this rhetoric when we talk about longevity and we talk about good health, my patients are constantly asking me, what do I need to eat? And it seems that our focus has been on food. And nutrition is very important, but we're forgetting to talk about the exercise piece. And so my piece of advice for patients out there seeking longevity is if you have 1 hour of the day or even 30 minutes in your day, and that's all the bandwidth that you have to dedicate to your longevity, I would highly recommend that you look into strength training. Because the strength training is probably going to be the biggest bang for your buck as far as longevity outcomes. In addition to cardiovascular training and nutrition, I mean, it all goes together as we've talked about sleep and emotional health and cognitive health. But again, if you just have that one thing that you can focus on, I'm going to have to push people towards strength training. So that's my wish that we can start that conversation.
Yeah, thank you. And I hope our listeners take that to heart as well. And thank you, Dr. Braxley, for a wonderful time. And I know I've learned a lot, so I hope everyone else has also learned a lot as well. So thank you so much for taking the time and coming out and sharing your advice with all of us.
It's my pleasure. Thanks so much for having me.